Okay, so what we're going to be looking into a little bit here. This is for nursing class, Unit 4, and as far as on your unit tests, I've noticed when I look through there that there are going to be probably about 6 to 7 scenarios where they're talking about a patient, and they may give some of the signs and symptoms that the patient has, or just some information about them. And what they're going to ask you to do for each scenario, they have a list of maybe 5 different types of nurses that are involved with patient care. And they want you to pick the type of nurse that would most likely be involved with each scenario that they give. So what we're going to do here, you've probably gone through a lot through your lessons, and I know you could probably come up if I asked you, give me some ideas of different nursing fields. My gosh, we could have pediatrics working with children. We could have cardiac, with heart conditions. We can have ortho where they work with maybe more of the bones system. We could have just med surg, which is just working with patients maybe that primarily that have had some type of surgery, neurologies, let's see, oncology with cancer patients. Just there are so many different fields that you can't even begin to list all the different fields that a person could go into in nursing. And what's kind of nice is that you can also, if you go into one field, you're not stuck in that. You can learn about another, and you can actually go, and actually work in different areas. Maybe you want to be here for a couple of years, then you want to maybe go and learn something about a different type of nursing, whether it be oncology with working with cancer patients. You can learn about that and then go actually work there. Or maybe you decide you want to go and work in ICU, the intensive care. So you have so many options, for diversification when you're in nursing, which is really fun to me because I don't like being stuck in one thing. But you can certainly stay. You do see some people that enjoy working with, oh my gosh, you could be working in the mother baby unit, for their 15, 20, 25 years. They love it so much that they don't even move on. So, but what we're going to look at here is just a couple of the different specific nursing types that you might be able to pick from some of these on your test when you actually have it. So I just want you to be familiar with them. So gastroenterology nurses, you can see that I've kind of highlighted it there a little bit. They're also known as it says, they're endoscopy nurses. Now, if you look at the words gastro, I don't know if sounds familiar, gastric, dealing with the stomach. So sounds like enterology, something maybe involved with the gastric, with the stomach, maybe the tubes going to it or from it, and sure enough, that's exactly what it means, the study of that. Endoscopy and like the scopy there, SCOPY, must have something to do with their scoping, in some orifice and looking for things maybe that are wrong, and the thing is, that is exactly what it is. Endoscopy is it's scoping into the body, and they can go through the mouth down into the stomach, into the gastric area. They could even go from the rectum. You can go in that way, and you can go up through the intestine, and they can check out, what's going on in there. So, you could work with, a lot of times you can actually work in the hospital if you're interested in actually assisting the physician with the endoscopy procedure. We have a picture there at the top, it looks like some physicians and nurses actually working with, they have the monitor on there that you can see that they're going to be scoping and then looking to find different things where maybe there's something like going in from the top. They want to check, why does this person have gastric reflux all the time or bleeding? Or maybe the person has abdominal pain all the time, and so they're going to have to scope one way or the other or both to actually go in and find out what's causing the problem. And it could be anything from ulcers to carcinoma to all kinds of things down here. So I don't know if you've ever heard of an EGD. That's where look at the word esophagus, so that they don't say the whole word, but esophagus, gastro, stomach, duod, that's the first part of the intestine. So they're going to actually scope, and you can see them going in through the mouth, and they're going to check out the esophagus. They go down to the stomach, and actually through the stomach and into that first part of the intestine down here, which is called the duodenum. And so they look for ulcers or cancer, whatever. But this is a very interesting job. I have some friends that work in this, and they really love it. But anyway, that's what a gastroenterology nurse, just a couple of things that they would be involved in. What if you were working with HIV or AIDS patients? Now, a lot of times, even if you're just on the floor, you could work in a doctor's office, you could work on the floor, you could, clinic, whatever. A lot of times, they don't even have a special floor for these patients that have HIV or full-blown AIDS. And a lot of times just the patients that come in either maybe for surgery or they have something else wrong, they come in but they are still an HIV patient or AIDS patient. It may not be the direct problem that you're working with at the time, but you still have to use the same precautions and a lot of the same medical procedures that you would as if you were working with them just because of the HIV or AIDS. Now, what's kind of interesting about AIDS patients too, though, is that they don't really die from AIDS. I don't know if you've heard much about them, but the AIDS actually affects the way that these patients become so sick is that the AIDS affects the immune system. And so these patients, the further they are along in the process of having this disease, the immune system doesn't work. So when you don't, your immune system is what fights off infection, whether it be viral, bacterial, fungal, whatever. When you don't have that great immune system, you're very precluded to getting many, many other things. So when you look over here, they get pneumocystis. They get oftentimes a disease process in their lungs. They can get TB, tuberculosis. They get skin tumors, all kinds of things. And like I said, it's not necessarily, in one way it is because of the AIDS, but it's not really the AIDS that kills them. It's the AIDS that affect the immune system and depress it so greatly that they come up with, multitudes of other disease processes and oftentimes die from one of those. So, there are different places that you can just stick to dealing with HIV or AIDS patients. And so that's a very helpful and a wonderful way to help people because a lot of times people are afraid to get around them. But if you use the proper precautions, then you can assist them greatly in their medical care and in progressing through that process of having AIDS. And there are so many treatments. I know, gosh, maybe 20 years ago they didn't really expect patients to live very long, but now with the medications that they have, they can live a very, very long lifespan, as long as they're maintaining on this medication. These different medications that they can use, not that they're ever well and they always have to watch for other things that could come and fight against their compromised immune system. Then we have an infection control nurse. This is kind of interesting, whether you're talking about any infection, viral or bacterial or fungal. There are actually special physicians that deal just in infection control. It could even be something like, Ebola somebody would fit into this. But what's kind of neat is a lot of times you'll see an infection control nurse that works in the hospital, and they monitor all the different infections that are going on to make sure that nothing has got out of hand and it's spreading in the hospital. If somebody comes in with something, you don't want it to spread. And so they work with other employees of the hospital, whether they be nursing staff, physicians, to make sure that that infection is not spread. It's kind of a lot of record keeping, a lot of research involved in that. So it's kind of an interesting field if you're interested in just different infections, how they spread, especially working in a hospital to prevent that spread of infections to multiple patients. It could spread out throughout the entire hospital. So then another one would be an occupational health nurse. An occupational sounds like has to do with an occupation, and certainly it does. It's someone who kind of works with workers, whether that be at Micron or some other business. An occupational health nurse works with them, and you can see some of the things that they're involved with there. They can provide counseling support to workers. They give oftentimes education, advice. they can, if someone's hurt on the job, they can actually, obviously, unless it's a 911 call, they can assess, they can treat the employees who are injured or become ill at work, maybe tell them that somebody should go home because they're spreading germs everywhere. They oftentimes will develop and manage emergency procedures. Sometimes, too, they'll even be involved with taking blood samples for a particular business and carrying out vaccinations, all kinds of stuff. So it's kind of a multi-faceted nursing job, if you're interested in that kind of nursing. This next one is my favorite, and that's where I worked primarily. I love cardiac nursing, so that deals, with people that have cardiac issues, whether, any problem with the heart, whether it be having a heart attack or any other disease process of the heart, hypertrophy of it, or, just chronic conditions, or ones that are more acute based, that have come about because of lack of exercise, poor eating habits, which you're probably thinking like clogged arteries, things like that. So you do all kinds of monitoring when you have cardiac patients come in. They usually have a telemetry unit, which means that the patient is in the hospital there or clinic, or it could even be for a rehab for a cardiac reason. And so oftentimes you'll be monitoring their EKG. I don't know if you've heard of that. An electrocardiogram, and so you can see this picture right up here shows what let me see if I can get my pointer there, there's electrical stimulation that's given off with all the functions that the heart does, and so you can actually see on a monitor the electrical signals that are given off, and just by looking at what's called that EKG and seeing that the picture that it shows you there, you can actually tell many times if something's going on in the heart, if the patient's having a heart attack, if they're maybe not getting, the heart isn't getting enough oxygen. You can oftentimes, if someone comes in with chest pain, and you can take an EKG and you can look at that that monitoring report there, and you can tell if maybe they need immediate an angioplasty because the artery is plugged up, and they can't, they'll have them chest pain and it needs to be done right now. So all of this, that's what a cardiac nurse does. Or even at the top here, you can see maybe they're going to do they'll take a vein out of the leg and they'll use that in the heart. It's called the coronary bypass surgery. Maybe one of the heart arteries is plugged, so they can actually take a vein from the leg. I think it's usually the saphenous vein. They take it out and they can actually sew it in to the heart and get it to perfuse. And even though the other artery is clogged, they can get perfusion to the areas of the heart that need it through this vein that they've actually taken out of the leg of that same patient. Or maybe that they need a pacemaker. Maybe the heart is just too slow, and it's not, because the heart is pumping so slowly, it's not able to perfuse adequately to all the cells that need oxygen. So they'll put in a pacemaker. So all of these really exciting, fun things are involved with cardiac nursing. So that's certainly another option. So we've talked about endoscopy nursing, or HIV, working with HIV patients, or infection control, occupational health nursing, cardiac nursing. So that's all that I really made up here. There's certainly, like we talked about at the very beginning, there are many different areas of nursing that you can go into. And like I said, you'll be seeing some scenarios that they'll give you, and they'll say which nurse, and like I said, they'll give you probably about 5 or 6 to pick from. Which nurse do you think would be the best suited, or has something to do with that particular situation? So if you have any questions on anything, give me a call. I would certainly look back through your unit before you take the test to make sure you're kind of familiar with additional areas of nursing. And good luck on your test, and thanks for watching. Bye-bye.